Hi, welcome to the pharmacology class, clinical pharmacology for nursing. And I hope that I'd like to just spend a couple minutes introducing myself and hitting a few highlights about the course that you're going to be involved in this semester. This will be packed full, and though it's a difficult course, you will learn a tremendous amount of information. And it'll be information that you can apply directly to your clinical practice as you begin your clinical experiences this semester. This course it really builds upon courses that you've had in the past, primarily your classes in anatomy and physiology, microbiology, if you've had chemistry, and also pathophysiology, which you had, I believe, last semester. So in terms of books, hopefully you had the fourth book, Essentials of Pathophysiology, and though that's not a course book for pharmacology, you probably may be spending some time in this. The course books are the Lenny book. This is let's see if I can get the camera. This is a study guide, which has a lot of questions, practice questions and things in it. So this can be really helpful in terms of preparing for exams. And then the pharmacology textbook is the Lenny Pharmacology 8th edition. This is a really a great book, and I would recommend that you read the preface to the book because there's features in it that will help you to read and prepare for class as you go through this course. A couple things about the course. You're going to be spending some time, actually more time than you may have in the past, on D12 because I've pre-recorded a lot of my lectures and try to keep most of them at least 30 minutes or less. Some of them run a little longer. And they're PowerPoint lectures, and so the idea is that you'll watch these at home or wherever you are, and you'll be prepared to do a lot of group work in class. So you will be in a group, and you've been randomized to a group of about 5 or 6 other students. And in this group work, you'll be in class. We will be primarily working on chapter topics, math, which is also a part of your coursework. It's the Picard 9th edition math, and I have it over here. It's called Dosage Calculations. So this is another textbook that you'll have too. And we'll be working on that. Plus, you'll be in a group that will make a presentation, and you will be able to select a pathologic condition like coronary artery disease or ischemic stroke or Alzheimer's or myocardial infarction, major depression, bipolar disorder, Parkinson's, schizophrenia. Those are just some of the selections. And as a group, you'll be making a major presentation running in front of the class about 20 minutes. So I'm going to be talking more about that with y'all as we move along. And I would recommend that you do as much reading and watching of my videos prior to class to be prepared to do work in class when we meet. Basically, and when you log into D12, you can also go and look at I've done a kind of an introduction to the syllabus, and you'll notice on the syllabus, basically the grades are divided down into quizzes, a midterm and a final, and then the group presentation. And the group presentation will be worth 200 points. The final will be 150 points. The midterm will be 100 points, and online quizzes will be 100 points. So I'll let you look at that. Another investment should be some kind of a drug guide. And I don't care if it's a book or an app for your device. Let's see, there'll be questions that come up in the course, and I think the best way to handle a lot of questions will be on D12. I will create a discussion post for questions for me, and then you can post those questions, and then when I answer them, typically other students will have the same question and they'll be able to see my reply. So the idea behind the philosophical basis for my wanting to do the course this way is to get you guys more involved in your own learning. I won't be focusing a whole lot on pathophysiology and anatomy and physiology, I really want my main function to be focusing on pharmacotherapeutics and the use of drugs in clinical settings. So that's going to be my focus. So it'll be really up to you to make sure that you understand the pathophysiologic basis of diseases and also just normal physiology in the body normally. So hopefully this, I didn't want to make this video too long, but I wanted just to say hi, and this should be a really good course. We should be working together quite a lot, and I should be able to get some help in the classroom to help you with group work, and we'll be doing some filming of some of your work for later use for learning. The sky is really the limit in terms of creating in this class, and so you should really be amped up about this and pretty excited. And I mean, I am. I love it, and this will be one of the mainstays of your professional practice. I don't have anything more now that I can think of. I didn't come scripted. I just kind of sat down and filmed this. So I'll see you in class, and hopefully you've seen this before the first class. If not, that's all right. So I'll see you then.